Good morning, everybody, and welcome to today's webinar. For those of you who are new to the GoToWebinar platform, you will have a box on the right-hand side of your screen where you can ask questions to either me or to Stuart. And at the end of Stuart's presentation, I'll come back to those questions and I'll feed some of that back to him. So if you've got questions, if you want some more information on anything during the webinar, please feel free to put your questions into that box. Before we begin today's webinar, I just want to quickly introduce a little bit about the webinar series that we're running and what's coming up and what's available to watch back in our archives. So it's the Breakfast Bite webinar series. For those of you who have been on a little bit earlier, you might have heard myself and Stuart talking about it. It's a weekly webinar series. Every Wednesday morning, we invite an expert on to talk about an issue that relates to homelessness and potentially COVID-19, typically topics that we haven't always dealt with within Fianza. And today's topic is around preventing child sexual abuse during the COVID-19 lockdown, and we're joined by Stuart from Stop It Now. He'll do a bit more of an introduction to himself and his organisation in a moment. I just want to flag just one moment. Then, of course, this is a webinar series that we've been running since the 25th of March. And for all the previous webinars, we have our recordings available on our website to watch back. So if you see topics that you're interested in the follow-up to this email, you'll have a link to watch them back. And just to know that in the coming weeks, we have webinars on self-care and art therapy, supporting resilience within our clients, eating disorders and self-harm during COVID-19. So please feel free to register for those webinars. And again, I'll send round the information to register for those after our webinar is completed. And lastly, I think a lot of people are joining these webinars that have either never come across Fianza previously or have done, but they weren't eligible for Fianza membership. I think what's important to know is that Fianza has changed our membership structure in the past 12 months. So previously you had to be a homeless service at a national level, operating across the country to join. Now that is no longer the case. You can be operating at a local level to join Fianza. You can also be a policymaker, so a city authority, a department, a ministry, an agency, foundations, think tanks. We've broadened our membership criteria because from our side, we believe that ending homelessness is possible, but we can't do it on our own. And it's part of our attempt to build broader coalitions across Europe and bring different stakeholders and important people together who have a role and a part to play in combating homelessness. You can see there are many benefits to joining Fianza, feeding into our policy, contributing to our thematic clusters. When COVID-19 is over, there'll be more opportunities for transnational learning exchanges, international best practices, and networking with your counterparts across Europe. So that's just a little bit about Fianza, what we're doing with our webinar series, and now I'm going to hand over to Stuart. And as Stuart sets up, just a quick reminder that you can ask any questions into the box during his presentation, and if you are interested in his PowerPoint, all that information will be shared as part of the follow-up. So Stuart.
Good morning from sunny Scotland this morning. My name's Stuart Allardyce. I work for an organisation called the Lucy Faithful Foundation, which is a UK-based charity which focuses on tackling child sexual abuse in evidence-based ways. And in particular, I head up our Stop It Now services in Scotland. And Stop It Now Scotland is an agency that works towards the prevention of child sexual abuse. What can we do to stop sexual abuse in the first place? So I'm absolutely delighted to be speaking with you this morning. Let me just share my screen. Now, Robbie, can people see that okay?
I can. Perfect. We can see the full screen. Great.
Okay. So I've been asked to talk about child sexual abuse prevention during COVID-19 lockdown. Can I just say right at the outset, this is a difficult subject. There's going to be nothing graphic or explicit that I talk about over the next kind of 20 minutes or so, but we will be talking about different forms of child sexual abuse. So apologies for this being an uncomfortable subject, but it just is an uncomfortable subject, and one that I think we definitely need to talk about. The Lucy Faithfull Foundation, just so you know, is an organisation that works with sex offenders, that works with people who have committed sexual offences against children. But actually, one of the things that we then do is we take the learning from working with offenders, which is a key part of child protection, in my opinion. But we take that learning and then we begin to apply that in various ways to look at what people can do to prevent child sexual abuse in the first place. That could be individuals who are worried about their own thoughts and feelings towards children, but they haven't done anything in relation to that yet. It could be how we work directly with parents and members of the public in relation to prevention. It could be how we make sure that professionals have the knowledge and skills that they need to be able to kind of prevent and tackle this issue effectively. And some of it might be about kind of influencing policy as well. What I'm going to do today is I'm going to talk about why this subject I think is of general importance, but why it's specifically important under lockdown. I'm going to talk a little bit about thinking about child sexual abuse as a public health issue, and then I'm going to signpost you to some resources for parents and carers, for people who are worried about their own thoughts and feelings towards children, some resources for practitioners, and then hopefully we'll have some time for questions and comments. It's going to be mostly signposting. We're not going to have much time to go into stuff in much depth, but at the end of the presentation, I've put up my contact details, so I'm happy to have further conversations about some of the material here if that would be useful. If there's one key message I would like to get across today, it's this. I'm sure all of you kind of watching this presentation are professionals who have worked with vulnerable adults and teenagers for many years. Many of you may be very confident in terms of child protection, work around child sexual abuse, what needs to be done to work with individuals who present risks to the general public and to children in particular. But some individuals may feel less confident in this area. I think it's worth holding on to the fact that everyone here probably works with different forms of risk on a day-to-day basis, whether that's risk around substance misuse or suicide or health issues or what have you. And actually, you probably all have lots of skills and experience in finding strength-based approaches to working with risk and reducing risk. So my wager is that you all have considerable skills and knowledge that are transferable to this issue about working with people who present a risk of harm to others, and indeed child sexual abuse prevention more generally. I think the issue is that we often feel extremely unconfident in this area and feel that it's an area for expertise, but we then forget that we actually have lots of skills and knowledge that we can apply to this particular subject. So I'd like people to kind of hold on to that as we go through this presentation. Let me say a few things, first of all, about prevalence. Child sexual abuse is sadly something that is commonplace internationally. These figures here, 1 in 5 girls and 1 in 20 boys, come from a couple of meta-analyses that were produced about 5 years ago, looking at victimization data in different countries around the world. In terms of the UK, different studies tell us different things, but it looks that like between 1 in 6 and 1 in 20 children by the age of 18 will have experienced contact sexual abuse. So the figures are significant. The reason why we have different kinds of figures from different studies is because of different samples, but also how sexual abuse is defined, because it clearly can involve contact sexual abuse, but also non-contact sexual abuse, whether it's an adult exposing themselves to a child, or an adult showing pornography to a child, or indeed an adult grooming a child in some way. And abuse can take place, of course, in both online and offline contexts. It's something that happens when there's a power difference, so most of the perpetrators are adults, but about a third of cases involve perpetrators who are adolescents under the age of 18 themselves. The overwhelming proportion of abusers are male. In terms of criminal justice data, it's kind of 99% and beyond in most jurisdictions. If you look at victimization data, it's around 90% of abuse that seems to be perpetrated by males, with about 10% by females. And there's an enormous issue in relation to underreporting. So we know that this is, from victimization data, a widespread issue, but actually most children do not disclose. Only around 1 in 8 children are known to police and children's services at the time, children who have experienced sexual abuse. There are several reasons for this. One of the main reasons is that the abuser is usually known to the child. 70% of abuse takes place in either the family home or the home of the abuser. There are also issues around shame, embarrassment, that kind of sit there for survivors of abuse. Many therefore don't disclose into adulthood, if they disclose at all. Grooming can be a factor in all of this. The way that abusers can normalize the abuse experience, and indeed threats and coercion, so that the child feels unable to disclose. It's also worthwhile noting that in some cases we find that the child may have disclosed either to a peer or to a parent or other protective adult, who then doesn't share the information for whatever reason. Without going into that in too much detail, our position at Stop It Now is that it's always absolutely right and proper for organisations to share information about abuse. That is something that is axiomatic in terms of child protection. But we need to recognise that sometimes, for instance, if a child discloses to a parent and the parent doesn't pass that information on, that's by no means optimum, but there are practical things that parents might be able to do that might actually promote safety in some way. So it's about making sure that parents have information about resources as well. That's really important. And just a kind of general thing here, the reason why this issue is so important is those who experience child sexual abuse, although it can impact in a wide range of different ways, there are quite strong statistical associations with issues around mental health presentations and substance abuse issues. Also, some specific issues around kind of psychosexual issues, which are quite statistically associated, as well as issues around re-victimization in later childhood and adulthood. So this is an issue that has an enormous social and economic cost in our society. 3 key challenges around COVID-19. Home is, for most children, a safe place. But I think we also need to acknowledge that in some situations, a child may have been abused within the family home, or maybe at risk of abuse within the family home. The abuser or potential abuser could be a parent or step-parent, but they could also be a sibling as well. And we're now in a situation where millions of children are now cut off from school, from friendship groups, kind of places of safety outside the family home, at a time where there's considerable stress in many households. There may be contextual factors here that are worth bearing in mind, particularly for those working in the homeless field. There can be issues around overcrowding that can be a contextual factor in some issues around child sexual abuse, and particularly things like co-sleeping arrangements at times as well. So that's worth bearing in mind. Risk of online solicitation and grooming. We know that adults and adolescents will at times have sexualized conversations with children online. That is a form of abuse, of course. It can sometimes lead to the child being abused offline, but more commonly will lead to further abuse of the child online, getting the child to perform sexual acts or send pictures of themselves. There's something called capping, which offenders talk about, which is trying to capture an image of a child which is compromising in some way, and using that image to basically extort further images from the child. We know from data that we're getting from Europol and the National Crime Agency in the UK that there seems to be increasing risk around online solicitation for children at the moment, with more and more children being online unsupervised. And also, I think at this particular time, there are risk of increased numbers of individuals viewing child sexual exploitation material, what the newspapers would call child pornography. In the UK, around 5,000 individuals are charged with these kind of offences on a yearly basis. But actually, the National Crime Agency data would tell us that around 100,000 individuals are looking at these materials on a regular basis. And although we know that some people will deliberately go online to look at illegal material, the much more common pathway is individuals who are gravitating towards this kind of material through looking at mainstream legal pornography, but becoming desensitized over a period of time and looking for more extreme and illicit material. So at a time where we know that from data from Pornhub, for instance, that more and more adults are looking at pornography, for a small subgroup that will involve individuals who have a problematic relationship with that kind of material and will move to much more illegal material over time. The other things worth saying are that it's obviously much more difficult to support vulnerable families and individuals in this period of lockdown. And all the police data is telling us at the moment that we should probably see a considerable upturn in individuals who are being charged with sexual offences when lockdown is lifted, which is worthwhile bearing in mind if you're a service provider. Thinking about sexual abuse as a public health issue, I'm sure many of you are aware of public health concepts, but if we think about a public health approach to heart disease, if I have a heart attack tonight, I'll go to hospital and receive surgery and treatment and rehabilitation. The event has already happened. I've had a heart attack. It's what we would typically call tertiary prevention, something that happens after the event. But actually, there are things that we can do to stop or reduce the risk of heart problems generally across society. Primary prevention would be the messaging that we get out to the general public about lifestyle and what people should be eating and exercise and so forth that might reduce the risk of people developing a heart disorder at some point. And then the secondary prevention, if I turn up at my GP surgery and I've got a high blood pressure, I'll be given some medication because I'm at higher risk of developing heart problems. If we apply all of this to child sexual abuse, normally we think about child sexual abuse as a criminal justice issue. A child has made a disclosure or there's sufficient evidence to charge an individual who's dealt with through the courts, and then that individual is either in custody or in prison, receives some kind of treatment in relation to their offending behavior, and indeed the survivor of the abuse may receive some kind of therapy or some kind of ongoing support. So the event has already happened. But if we think about this particular model here, there may be things that we want to get across to the general public that might be helpful in reducing risks of sexual abuse. Do all parents and indeed all members of the public know what sexual abuse is and know what some of the practical things are that they can do if they're concerned around sexual abuse? And also in terms of secondary prevention, are there particular kinds of situations where there is increasing risk of sexual abuse happening, where we might be able to intervene effectively in some way? So our position at Lucy Faithfull Foundation and Stop It Now is that we need to see this as a criminal justice issue, but actually ideas around prevention become much more available if we begin to think about it as a public health issue. So let's look at some of the kind of practical things that people can do to prevent abuse and what kind of resources are out there. These are a couple of resources for parents. On the last slide that I have today, there will be hyperlinks to all of the websites that I'm going to signpost you to. On the left of your screen is a website we in Stop It Now Scotland launched in November of last year called Upstream, which is for parents and the general public about child sexual abuse prevention and some of the things that you can do to identify and prevent abuse happening. The website on the right is from our parent charity, the Lucy Faithful Foundation, the Parents Protect website, which covers a lot of similar areas. There's also a website called Darkness into Light in the United States that covers basic areas such as this. So these websites are designed to give parents and members of the public the basic kind of tools that they need to think about this issue and know how to respond. The Upstream website in particular is structured around a number of issues or questions that might come up for parents or family members. So if you're worried about the way your uncle is playing with your 3-year-old daughter, what choices do you have? What are some of the practical things that you could do? So Upstream would look at and present a few different options that might be available for individuals in that situation. Or, you know, you might be, your sister has 2 young kids and has met a new boyfriend. And you have a bad feeling about this and you want to have a conversation with her, but you want to have that conversation so it's constructive. And it's about prevention and the positive things that we can do about prevention. Or you come home one day and you find something on your husband's computer which makes you quite concerned. Now, clearly you can go to the police, but we need to accept that some individuals won't do that. So what are some of the practical things that an individual can do that actually might reduce risk in that particular situation? And both of these websites talk particularly about how we engage with children directly around prevention. So how do we talk to very young children about healthy boundaries and privacy and their own bodies? How do we talk to older children about online safety? And indeed, how do we talk to adolescents in particular about things like consent? So all of these websites have loads of resources for parents in these areas. Other websites are available, and here are a couple. Think You Know is a website that was developed in the UK by the National Crime Agency and the CEOPS Child Exploitation and Online Protection Command. Loads of resources and videos for parents and children themselves around online safety for children of different ages. And indeed, this particular website has got some fantastic resources for a kind of COVID-19 context as well. I can't recommend the NSPCC website highly enough as well. If you get to the right section, there's loads of information available there for parents. You can see here sections around online safety, about reporting child abuse and neglect, but also stuff around kind of sexual behaviour in children, what's okay and what's not okay, and how you might respond if you're worried about your child's own sexual behaviour. So loads of great materials there. And indeed, one of the materials that's on the NSPCC website is Pandasaurus. Pandasaurus is part of the NSPCC Talk Pants campaign. And I think it would be really great if professionals who are working with any kind of family at the moment would encourage family members to engage with their children in lockdown and looking at some kind of key messaging around sexual abuse prevention. Pandasaurus is great for younger kids. It's based around songs and it's based around the acronym PANTS, which stands for a number of things. P is privates are private. A is always remember your body belongs to you. N is no means no. T is talk about secrets that upset you. And S is speak up, someone can help. So kind of clear messaging to get across to all children that can contribute to sexual abuse prevention. And the resource on the right is something that you'll find on Parents Protect and also the Upstream website, which is a resource for parents who are worried about their children's online behaviour. So what are some of the practical things you can do if you are worried about your teenage child looking at pornography or sharing pornography with younger siblings, for instance? What might you do if you're worried about your child sharing sexual images with a boyfriend or girlfriend? So looking at what could possibly be problematic online sexual behavior displayed by children, in particular adolescents, and practical things that parents can do in these kind of situations. So some great resources there, but this is one that kind of pulls together kind of messaging from a number of different sources. So that's a range of resources for parents that I think we as professionals supporting families should know about and should be feel comfortable in kind of sharing with families in this time of elevated risk. There are also resources out there for adults who are worried about their own sexual thoughts and feelings towards children. These may be individuals who have already committed an offence and are convicted. But it might be individuals who are worried about their thoughts and feelings but haven't committed an offence, or indeed those who are worried about their thoughts and feelings and have committed an offence but have not been arrested yet. The Stop It Now helpline, you can see the number there. This is a UK helpline, and it's there for people, anybody who's worried about anything in relation to child sexual abuse. It's completely confidential and anonymous. That's the important thing, that people who contact us are told right at the start that if they give us identifying information of a crime, then we will need to pass that on, but they can use this in a completely anonymized manner. So the helpline is open Monday to Friday each week. Last year, we had 9,000 calls from 5,000 individuals in the UK. And about half of those individuals were people who were worried about a particular child, usually their own child, and they wanted to act in a more protective or preventative way because they felt that there was some identified risk to their own child. About half of the calls came from individuals who were worried about their own sexual thoughts and feelings towards children. So resources are out there, and indeed on the right-hand side, you can see on the Stop It Now website, we have a section for people who are concerned about their own thoughts or behaviours towards children. When you click onto that, it takes you to a section for those who are worried about the online behaviour and those who are worried about the offline behaviour. But there's also a section for if you're worried about a loved one and their own behaviour or their own thoughts and feelings, or indeed if you're worried about a child or young person's behaviour. There are similar resources elsewhere in Europe and indeed countries outside Europe as well. There are helplines that we know of in Stop It Now helplines in Netherlands and Flanders, and indeed similar helplines in Finland, Sweden, Germany, and a range of other countries as well. So those kind of resources are there, and indeed, if you're working with individuals where there are concerns around whether they present a risk to children, it might be worthwhile flagging up that there are these kind of resources that are out there that can provide anonymized support if somebody's worried about their own thoughts, feelings, or behaviours towards children. And all the evidence would suggest to us that actually many individuals do use these kind of resources in constructive ways, and that there's fairly good evaluations of these kind of supports. A couple of final slides. This is a resource that we relaunched in February of this year from the Lucy Faithfull Foundation. It's called the Eradicating Child Sexual Abuse Project. It's really a search engine for practitioners who are interested in the child sexual abuse prevention field. So as you can see from this presentation today, actually when we talk about prevention, there can be many different prevention targets. We could be targeting individuals who may present a risk to children themselves. We may be targeting children, making sure that they have the knowledge and information available to keep out of risky situations. We may be engaging with parents so that they can act more effectively in terms of the prevention efforts. And actually, we could be engaging with situations where there are elevated risks, or we may be just providing kind of general kind of messaging, or we may be working with people after abuse has taken place. What this particular website does is it signposts practitioners two different kind of resources that are being used internationally in different countries. So if you wanted to find out some of the different kind of resources that are being used in your particular area around child sexual abuse prevention, recognizing that there are different prevention targets, this would be a great place to go. We're doing some work on this website at the moment, so that probably the week after next, there'll be some specific materials in relation to COVID-19 as well that will be up on this website. And just to finish off, this is my last slide. I think there are lots of things that we can be doing as professionals at the moment. One of the things that we probably need to be doing is making sure that we and all of our staff and colleagues know what child sexual abuse is and know how we should respond to concerns. And that's particularly in recognition that there may be higher levels of reporting and disclosures that emerge after the lifting of lockdown. So that might be about knowing your own procedures and guidance, or updating procedures and guidance. It might be about looking at what resources are out there that people can draw on. And indeed, if you want more information about what child sexual abuse is and how organisations should respond to concerns, then you will find things on things like the Upstream and EXA website. I think at this particular time, we should all be looking at ways of supporting parents and speaking to their children about online and offline safety, and taking practical steps to prevent abuse. If risks are arising in family settings, then it may be helpful to promote the idea of safety plans with families. And indeed, you'll find examples or exemplars of safety plans on both the Upstream and Parents Protect websites. For those where there may be kind of emerging risks, or indeed risks are perhaps already known about, then it's, I think, really important to signpost individuals to relevant supports, including anonymous helplines, which are available in many countries. And I think we should know what resources are out there that we can integrate into our day-to-day practice and our training and ongoing professional development of our teams. That's the main areas I wanted to cover. There's lots more that can be said in this area, but my contact details are here, and clearly people can get hold of this presentation afterwards, and feel free to get in touch. But we've got a bit of time, I think, for kind of questions just now.
Perfect. Thanks very much, Stuart. Just turn my own camera back on. Great, there we are. Thanks very much for this presentation. Really, really interesting, and I think quite topical for a lot of people at the moment as well. Just looking at some of the questions that started to come in, I guess the first is, you mentioned the 3 forms of prevention, looking at it as primary, secondary, and tertiary. Where do you see the homeless sector fitting in to the different levels of prevention, and what actions should social workers in the homeless sector be taking?
So I think all those 3 different levels have relevance for the homeless sector. I think that you will be working with individuals, I would have thought, in many organizations, and I'm saying this as a social worker who started off working in the kind of youth homelessness sector kind of 20 years ago, working with children who were leaving care. That you will be working with adults and sometimes adolescents who have been convicted of sexual offences. And clearly there will be issues around public protection and risk management that need to be attended to there. But also you will be working regularly with vulnerable families. Some vulnerable families which may have already been affected by sexual abuse in various ways. And that's the area where I think kind of secondary prevention and making sure that that professionals know what resources are out there, that they're able to share resources with families, but also can ask for advice and support as professionals themselves in these particular kind of situations is vital. And I think more generally, particularly in working with all kinds of families that we come across in the homeless sector, making sure that there's some kind of general information that's given around child sexual abuse prevention may be important from a primary prevention point of view.
Okay, perfect. Thank you. And a reminder to participants, you can ask questions in the question box on the right-hand side of your screen. I have a second question from Angela. Says, excellent webinar, but how do we raise greater awareness of child sexual abuse with the general public, given the greater risk of given the greater risk that COVID-19 represents?
Gosh, that's a great question, and it is really difficult. I think the biggest risks that we can practically respond to are the stuff around online safety, and making sure that at a time of lockdown, when all parents are thinking about homeschooling, asking that all parents kind of integrate some kind of messaging, some kind of lesson plan about online safety, and indeed stuff around kind of healthy relationships as kids get older can be absolutely vital. I think that there's a bigger issue that sits behind this as well. Not to dwell too long on this, but I think one of the difficulties that we have around child sexual abuse prevention, both in the UK and in other jurisdictions, is we conceptualize this issue in the wrong way. That quite understandably, the media covers issues around sex offending, looking at the absolute most serious of cases after people are convicted. It's absolutely right that there's coverage of these kind of cases, and those cases are often very disturbing. But even the most dangerous offenders had a period in their life where they weren't an offender. And I think there's an assumption that people wake up one day and decide to sexually abuse children. What all the evidence tells us is that actually what generally happens is sexual abuse occurs usually within the context of boundary violation over a period of time. Individuals who are involved with either online or offline boundary violation. So a lot of people who are involved with online solicitation of children have been involved with lots of kinds of risk-taking sexual behavior online, often interacting with adults online, but over time finding actually that young people can be more easily manipulated to do the kind of things that the adult wants people to do online. So people move towards abuse over a period of time. That's not always the case, but it's generally the case, which actually gives us lots of opportunities for kind of messaging that are really important, that might have some kind of deterrent function. So I think it's kind of recognizing that abuse is a process and that we can interact with that process in various ways.
Okay, I think that's actually, and it kind of comes back to what you were saying earlier about the different forms of prevention and the resources for the different stages that you're dealing with. That's actually it for the questions. I think you must have had a very clear and concise presentation, because there doesn't seem to be too many questions for clarity. And a reminder to everybody that the PowerPoint will be sent around along with the recording of this webinar. And as you know, Stuart's contact details are in the presentation. So if you have any follow-up questions or thoughts or questions that occur to you afterwards, I'm sure you can get in touch with either of us. Thanks very much, Stuart, for joining us today. We really appreciate it. And I hope everyone has a lovely day.
Thanks, Robbie. Cheers. Bye.
Bye, everyone.